Կազմակերպութեամբ ՀՕՄ.ի Թորոնթոյի Ռուբինա մասնաճիւղին եւ Օնթարիոյի Գանատահայ Բժշկական ընկերակցութեան Դոկտոր Միրա Միթրիի հետ զրոյցը հոգեմտային առողջութեան mental health-ի մասին տեղի ունեցաւ մարտ 23-ին Հայ Կեդրոնի սրահին մեջ, որ մե մասեր կներկայացնենք ցեզի։
ՀՕՄ.ի եւ Օնթարիոյի Գանատահայ Բժշկական ընկերակցությունը մշտապես գաշխատին, որ մեր համայնքին ավելի իրազեկ դարձնեն ֆիզիկական եւ հոգեմտավոր առողջության կարեւորության մասին։ Նմանօրինակ դասախոսություններ կամ ցերնակներ բարձրապես դասախոսություններ չեն, այլ հրավեր են մեզ յուրաքանչյուրին, որ ավելի առողջ եւ հոգեմտավոր գիտակից կյանքը ողջագրելու համար։ Խորավես շնորհակալ ենք եւ երախտապարտ ենք մեր շատ սիրելի բժշկուհի Միրա Միթրիին, որ սիրահոժարորեն ընդունեց մեր այսօրվա առաջարկը, որ մեզի ներկայացնե այսքան գենսական միտքը, որ կհետաքրքրի մեր բոլորին։ Վստահ ենք, որ այսօրվա դասախոսությունը եւ այս նյութին շուրջ ծավալվող քննարկումը խորաբես պիտի ծառայե մեր համայնքի մեջ ավելի խոր գիտակցության զարգացման եւ հոգեմտավոր առողջության մասին ավելի հստակ եւ օգտակար երկխոսության ստեղծման։
Մասնավոր շնորհակալություն գուզեմ հայտնել այս դասախոսությունը կազմակերպող հանձնախումբի անդամներուն, որոնք մոտ 3 ամիսների ի վեր միասին աշխատին կազմավորելու այս կարևոր ցերնարգը։ Մենք հարմար նկատեցինք այս դասախոսության նյութը ներկայացնել ցեզի, որովհետև հոգեմտային առողջություն ունենալը կամ հոգեմտային առողջություն գործընծնելը մեծ աստեցություն գունենա մեր բոլորին առօրյա կյանքին մեջ։ Եթե դուք առողջ եք, վստահ եմ, որ ձեր ընտանիքի անդամներեն, բարեկամներեն կամ գործակիցներեն մեկը առողջ չէ եւ պետք պիտի ունենա սորվելու այս կարևոր նյութին մասին։ Today, Rubina chapter has 412 members and it works through its 18 committees to organize many events during the year. A portion of the profits from many of its events are donated to various charitable organizations, including the ARS Armenian Private School, and to all of the initiatives undertaken by ARS Central Executive Board.
ACC was founded in December 1988, just after the earthquake in Armenia. For over 35 years, our organization has worked on creating many projects. We also led many initiatives over the years locally, like health fairs, a blood donation drive, Brushamania for our school children, hosting an AMIC medical conference, and many lectures similar to this one for the community. As Artsakh sadly now is gone, at least for now, our focus turns to mainland Armenia and the needy population that has settled there. We are currently working with our parent organization, AMIC, which is the Armenian Medical International Committee, and AIDA, which is the Armenian International Dental Association, on a new project for a mobile clinic serving the Siunik region, which currently houses a large number of the forcibly displaced people in Artsakh. Please join us as we continue our mission for a healthier Armenia.
Dr. Mitri is the quality improvement lead at the Vaughan site of the Mount Sinai Family Health Team and is continuously working to improve patient experience, care, and health outcomes at the clinic. Dr. Mitri has interest in research and scholarship and has collaborated on projects about antibiotic resistance, the effect of adverse childhood experiences on cardiometabolic disease, pest management policy, and factors influencing a career choice in family medicine.
We are going to be speaking about mental health and what mental health is. I'm going to speak about the causes, some symptoms of mental health, and we are going to be speaking about as well what are some of the factors that influence people. And We are also going to speak about treatment and including self-care. In medicine, we like to use the biopsychosocial model to evaluate health in general and mental health specifically as well. And so what this is the complex interaction between biological, psychological, and social factors and how they interact with each other to lead to health or potentially lead to illness or other conditions. So I've listed here a number of mental health symptoms. It might be a bit hard to see, but essentially they go from physical symptoms or more cognitive symptoms. So those can be, for example, a panic attack. Someone might feel very nervous, have their heart racing, be sweating, be a bit shaky, and having chest pain, but also at the same time, they have a lot of fear, so that's more of a cognitive symptom, a fear of dying or a fear of losing control in that very situation. And these symptoms, all of us can have them at any point in time, but if they are persistent or they're more severe and impact someone's life, that's when they're going to be potentially diagnosable as a mental health condition. And so when we speak about diagnosis, we look at the DSM-5, which is in its current edition. This is a guidebook that's published by the American Psychiatric Association, and it lists all the psychiatric conditions or all the mental health conditions and their diagnostic criteria. I've included some examples on the slide, but it's certainly not exhaustive. So depressive disorders are part of them, anxiety disorders, bipolar disorder, obsessive compulsive disorder, trauma, PTSD, and so on. So how are we doing in mental health in Canada, with mental health in Canada? It is estimated that about 20% of Canadians have a mental health condition in any given year. And that by the time someone's 40, there's a 50% chance that they might have been affected with a mental health condition. The rates are even higher, and the increase is even higher if we look at the group that's women, age 15 to 24. And so, for example, for social phobia, it's about 7% in everyone age 15 and up. And if you look at women age 15 to 24, it's actually about 25%. And that's quite the difference as well. And there are many factors, again, that can be impacting here, some of which we'll talk about, like potentially social media and COVID pandemic. And this social phobia is a condition known as social anxiety disorder now. And this is where someone might feel a lot of fear and anxiety in public settings. And that could be speaking in public or even just being in a one-on-one or small group conversation where they have so much fear that they will be scrutinized, and then as a result either go through this situation with a lot of distress or they avoid it altogether. And it's not a surprise that COVID, with its social distancing policies and how we were all somewhat isolated for some chunk of time, could potentially lead to such trends. On this graph, they've listed the OECD countries, and we see that the green-blue diamond is the 2019 rate of depression. The blue bar is the 2020 rate, and the orange diamond is the 2022 rate. And so we see that the depressive symptoms and the diagnosis of depression went up during this time frame and was actually worse in 2022 than in 2020. It had a big impact on youth. In 2020, almost 25% of hospitalizations for youth aged 5 to 24 was for mental health reasons. And that was an increase from 2019, where the rate was about 20%. Why do we care about loneliness? Loneliness has almost become an epidemic now, and it leads to premature mortality. So premature death, that's the same as that of smoking 15 cigarettes a day for years. So that was quite shocking to me when I read that. it causes more mortality than obesity. And so it's important that we try and do something about it. It can also lead to more heart disease and stroke and increased risk. And loneliness or social connection could actually lead to potentially better immune system. Treatment. So I've broken up treatment into 3 broad categories. The first one being self-care, the second one psychotherapy, and finally medication. Sleep. Sleep is important to all of us. Good sleep can make it so that we feel better emotionally and physically, but it's also important to recognize that sleep, insomnia, whether sleeping too much or sleeping too little, is actually a symptom of some of these mental health conditions, like anxiety or depression. I know it's hard, but I often recommend to people to try and adhere to a sleep hygiene. So trying to keep the same schedule on a daily basis, trying to go to bed at the same time every day and wake up at the same time every day. Avoiding heavy meals, avoiding very strenuous exercise, alcohol or caffeine before bed. Unplugging, putting the phone away, the iPad away for 30 to 60 minutes before bed, and then using those last 30 minutes to do something relaxing that is screen-free. So something like reading or meditating or praying or journaling even. Nutrition is also very important. So how this is important is because some of the nutrients that we have in our diet can impact the production of neurotransmitters, which are those chemical messengers that transmit messages between brain cells. And so things like B12, magnesium, iron are important, and they can affect one's mental health. So when someone comes to me in my office and says they have symptoms of sadness or anxiety, these are the first things that I check, along with the thyroid function. And so they've done a lot of studies assessing diet and trying to see what diet is more helpful. And the rate of the depressive symptoms was actually between 20 and 30% the difference that it would make if one does not eat processed food and one eats, as healthy as possible. Physical activity, yes, not right before bed, but it is very important as well. It has been shown to reduce symptoms and severity of depression. And so what we're talking about here is about 3 to 5 times a week, 45 minutes to 60 minutes. And that's, on the low end, that's about 150 minutes a week, which is what we recommend to the average person, average adult showing up for their preventative health care visits. And that could start with walking, and you can aim for 150 minutes. You don't have to start with that. I'll talk about cognitive behavioral therapy for a little bit. So this is first line usually. It's very common type of therapy. It's short term, and the goal of it is to challenge the unhelpful thoughts and behaviors in any one person. And these could be, again, different for everybody. So imagine you see a dog. Your thought is, oh, this dog's gonna bite me. And so your emotion is to feel fear, and your response would be to run away. So imagine if, when you saw that dog, your response or your thought was, oh, this dog is so cute. So you might feel happiness and go to pet it. So the same situation produced 2 different responses and 2 different states of being in that one person. And so it's a bit of a simplistic approach to what I'm explaining, but that's the gist of it, just to kind of give you an idea. And this also has an effect on neuroplasticity, this type of therapy. So finally, we'll talk a little bit about medications. Medications are affecting neurotransmitters, so those chemical messengers in the brain. So what happens is these little bubbles here are serotonin. That's released from the first cell, sends a message to the next cell, and eventually gets reabsorbed. What SSRIs do is they block that absorption at this site, and so more of it is available in the space between the 2 nerve cells, so there's more messages that can pass. And usually we treat for 6 to 12 months at least. It could be longer, of course. And people need to not stop quickly, and you need to taper because it can cause withdrawal symptoms.